Unlike other fossil fuels, gas is often thought to be relatively clean. As the global movement to phase out coal intensifies, people are increasingly looking to gas as a power source for carbon neutrality. However, a report recently published by SFOC reveals the dark side of gas power generation. The study finds that gas power plants in South Korea emit harmful pollutants and can cause tens of thousands of premature deaths. Currently, a total of 99 gas-fired power plants are in operation in South Korea. These power plants are located in Gyeonggi-do and Incheon, where electricity demand is high, as well as in Chungnam, Ulsan, Jeonnam, and Busan. Gas power generation accounts for the largest share of total power generation in South Korea, after coal and nuclear power. In addition, the Korean government plans to increase the installed capacity of gas to 59.1 gigawatt by 2034. Unlike its image of being a clean fuel, gas is in fact a dangerous fossil fuel that emits as much as 60% of carbon emissions from coal power, thus accelerating the climate crisis. In addition, gas power generation emits harmful air pollutants such as nitrogen oxides, carbon monoxide, and fine dust. When exposed to more than a certain concentration of these air pollutants, diseases such as myocardial infarction, difficulty in breathing, and asthma can occur, and in several cases, it can lead to premature deaths caused by heart and lung diseases. There is no doubt that gas power generation is bad for our health. But to understand how much harm it can cause, SFOC analyzed potential health impacts using gas power plant and air pollution data. Assuming two policy scenarios by 2064, we calculated the extent of health damage under each scenario.
Current policy scenario is based on South Korea's 9th basic plan for long-term electricity supply and demand, and follows its capacity development plan accordingly, so that by 2034, gas power generation reaches 59.1 gigawatt. This scenario also assumes a 30-year lifetime based on the government's lifetime management guidelines, meaning that the last gas power unit would retire in 2064. The second scenario is called the net zero scenario, as it follows the International Energy Agency's recommendation that urges advanced economies, which includes South Korea, to reduce the emissions from their power sector to zero by 2035. We found that the net zero scenario results in substantially greater health benefits compared to the current policy scenario. Under the current policy scenario, cumulative premature deaths are estimated to reach 23,200 between 2021 and 2064. But the net zero scenario would accumulate a significantly lower number of 5,360 until 2035. This means that 17,840 premature deaths can be prevented. This is equivalent to being able to avoid 70% of premature death. The differences are evident in the annual impact as well. Under the net zero scenario, the annual number of premature deaths would reach its peak at 571 in 2027, and by 2035, there are no more. Under the current policy scenario, is estimated to reach 859 in 2035. This is the year when the construction of all new plants are expected to be completed.
If all gas power plants in South Korea are to shut down by 2035, an average of 18,840 and a maximum of 32,200 premature deaths could be averted. In addition, 431 premature deaths will have occurred in 2021 due to air pollutants from gas power plants that are currently in operation. So what kind of policies should be implemented to protect the public's health according to this new research?
We propose that the Korean government first and foremost withdraw all plans to build the 35 new gas units that are currently in pipeline. We also need to manage air pollution from the gas plants more rigorously and enhance the emission standards. Air pollution from gas plants increases during the startups and shutdowns, but currently these non-steady state operations are exempted from emission standards, which means that excess amounts are not regulated. Lastly, we advise the Korean government to withdraw the policies that facilitate financing for gas power plants. Notably, the Ministry of Environment is currently going through the process of determining whether to include gas power generation under the green economic activity category. This not only encourages the expansion of gas power generation, but also justifies systemic gas power financing.
There is no more room for fossil fuels in the face of a climate crisis. Now that it's clear that gas power causes as much health damage as coal power generation, the construction of new gas plants must be withdrawn to prevent both a climate and public health crisis.